Okay, it's Ramey. I'm back. Um, the arguments against having universal health care. Critics of universal health care do not necessarily deny that the current system has problems. Their concern is the universal systems create new risks. The first and always most important is taxes and government spending. Um, Virtually every country that has universal health care has a higher tax rate. Um, and then the question of the way we spend money in this government, um, will they be able to do that efficiently? Um, Implementing universal health care could cost 30 to 40 trillion dollars. That's just somebody's estimate over 10 years, depending on the design. Even if some of that replaces current private spending, critics argue that the required tax increases would be too much. The second is government bureaucracy. Opponents worry that when the government becomes a dominant player, the system becomes slower, more politically controlled. And instead of dealing with insurance companies, doctors, and patients, we end up dealing with agency regulations and approval boards. The third thing is wait times and rationing. Some universal systems struggle with long wait times for non emergency procedures. For example, Canada has experienced lengthy waits for certain elective procedures, and the United Kingdom has faced ongoing challenges with waiting lists and such. Critics argue that when prices no longer regulate demand, systems often ration care through waiting lists. Fourth is innovation. The United States leads the world in pharmaceutical research, medical technology, and advanced treatments. Critics argue that the strong profit incentive in the US system helped drive innovation. Heavy government price controls, they say, could reduce the incentives for research and development. And finally, critics warn about the disruption. Around 156 million Americans currently receive health insurance through their employer. Transitioning to a universal health system could disrupt existing coverage, eliminate jobs in the insurance industry, and create major changes for hospitals and providers. For critics, the fear is just not to change. It's replacing one of the imperfect systems with another that might be harder to fix once we centralize it. Next, we're going to discuss immigration, both legal and illegal, and how that affects the healthcare system. That's something that obviously with current events is in front of mind. So I'll see you then.